Okay, so this is BIPOC maternal mental health and breastfeeding. My name is Edouard Tortu, CPD. This is a sample table of contents. This is my bio, history. So families were separated. BIPOC women were examined without consent. BIPOC women were sexually abused. They were forced to breastfeed white children. Today, BIPOC women face implicit bias, discrimination, racism, and toxic stress, also known as weathering. BIPOC women also face maternal morbidity, maternal mortality, and fetal demise. BIPOC women are also forced to use infant formula to feed their babies. There's also a lack of breastfeeding support for BIPOC women. Data. According to the Maternal Mental Health Leadership Alliance, July 2023 data, about almost 40% of Black mothers who experience maternal mental health conditions. Black women are twice as likely as white women to experience maternal mental health conditions, but half as likely to receive care. Single Black mothers are 6 times more likely than the general population to experience depressive symptoms. According to the Urban Perinatal Education Center Capital Campaign, the Perinatal Capital Campaign, a community survey reports that participants chose mental health and cultural responsive pregnancy, postpartum education, and care as top issues related to pregnancy and birth. This is an organization called Sister Fire. They made a survey in 2020. If you would like to know more about this, please go to YouTube and look up Sister Fire Voices of Change. But according to Sister Fire 2020 survey, they found that participants ranked the following most important topics to improve the well-being of parents and caregivers. First being mental health, 68%. Second being pregnancy, postpartum, education, and care, 41%. Delayed prenatal care. So during pregnancy, women with delayed prenatal care by race and ethnicity in Rhode Island between 2016 and 2020. The highest percentage is American Indian and Alaska Native at 23.6%, and the second highest is the Black population at 21.6%. This is according to the Rhode Island Department of Health data. Maternal postpartum depression. So depression during or after most recent pregnancy by insurance status in Rhode Island, 2018 through 2020, according to the Rhode Island Department of Health, 29% of those had Medicaid/right care insurance status, health insurance status before pregnancy, preconception, insurance status before pregnancy by race ethnicity in Rhode Island, 2016 through 2020. As you can see, non-Hispanic Black has the highest of right care Medicaid coverage at 43%, and 8% were uninsured. Breastfeeding. So breastfeeding and formula feeding at birth by race ethnicity in Rhode Island 2016 through 2020 data. As you can see, Black and Hispanic populations were lowest at 62%, according to the Rhode Island Department of Health. This is a video from the Rhode Island Department of Health, um, from doctor kind of like perspective. So please go on YouTube and check the Rhode Island Department of Health weekly wellness check-in and get a chance. Next steps. So the next steps could be providing breastfeeding and lactation classes to BIPOC women who are pregnant or recently gave birth. Also, providing breastfeeding and lactation support groups to BIPOC women. Also, expanding the workforce to include a diverse population of professionals in order to support BIPOC women who are pregnant or just gave birth. So, for example, certified lactation counselors or certified lactation consultants. Also, paying attention to legislation and different bills and legislation that can support BIPOC women, such as the lactation bill. This is an example of that in Rhode Island, and lactation professional licensure. In conclusion, breastfeeding benefits mothers by creating a strong bond with infants and decreasing risk for postpartum depression, type 2 diabetes, and hypertension. Breastfeeding provides significant social and economic benefits, including reduced costs to the family, reduced health care costs, and reduced employee absenteeism. And this is according to the 2024 Rhode Island Kids Count Factbook. Thank you for your time. I can be reached at EDLATORTUE at WOOSADOULA.com. So that's edlatortu at woosadoula.com. I can also be reached at woosadoula on Facebook and woosa_doula on Instagram. Thank you for your time.